This is Dr. Chris. I'm going to show you today how we do a biometric kit. So this is one of the things that my employer has community paramedics do. We issue this kit that patients are now able to go home instead of staying in the hospital. It helps clear out the hospitals of people so that COVID patients can come in and people who couldn't get care because of COVID patients clogging up the hospitals. And home is really a better place for people to heal anyway. Less infections, we call those nosocomial infections, those acquired in the hospital. So this is better to avoid that, and this is one of the things that community paramedics do, and amongst many other things. So this is the tablet here. Turn it on. And so while that's starting up, I'll explain what our goodies are. This is just an instruction sheet. There is a blood pressure cuff that's automatic. There is a pulse oximeter. Both of these have Bluetooth capability and send it right to the tablet. This is the blood pressure cuff for the blood pressure machine, or sphygmanometer if you want to be technical about the whole thing. Just plugs into here. So if it falls out, it's a short cord, so sometimes people put it on and it falls out, just plug it in there. So this is your charger. There's two sets of each. So we have two cords, two plugs in case one of the cords gets damaged. You have a backup. Both the pulse oximeter and the blood pressure cuff have batteries. So you've got fresh batteries here in case your device is without. First things first, you have to sign the consent form. Hit next, next, next until it gets to the white box, and then you can just sign it. Now we're ready to go. This has all been pre-programmed before I got here. I got on the computer, put the patient in this device is unique to her. What she just signed is something that says basically if you lose it or break it, you bought it. And this right now goes for about $460 something if the setup's lost. Also know that your nurse practitioner will call you on this and check in daily. Your time is tomorrow at 9:30. When that happens, the phone will ring. You will hit this button here and it will answer. And in your case, your nurse practitioner is Veronica. She will see you, you will see her. So it's really important that you're aware of what's going on around you. So just make sure nobody's walking in their skivvies behind you, and please don't answer it in the toilet. This is the pulse oximeter. You can either do this, put your finger in, or you just put your finger in. When you stick your finger in, it'll automatically turn it on. When this is done, a voice will then come on, and I'll let everybody decide what they think about the person's voice on here. I think she may have gone out and had a really good time last night, but you judge what her voice sounds like. So let's try it. So go ahead, put that on. Pulse oximeter starting. So it says 98 and 83.
Oxygen level 98, heart rate 84.
Okay.
Then you can take it off. It will turn itself off in a little bit. Now, had we not been successful and you got that reading, you can manually enter your vitals. You can just do the press here, and then it'll walk you through, and then you'll type things in. So this is your blood pressure cuff that's already plugged in. What you want to do, this is made for one person to put it on, but you can get a helper if you want. Velcro works really well. Don't get it on the floor, you'll have fun for quite a while. So I'll demonstrate on myself. Obviously you want to have less clothing on, bare arm preferably. You want to not cross your legs, that can artificially increase your blood pressure. So you put it on above the antecubital here, or what we call the crooks in the elbow here, the front of the elbow. Take this and you just wrap it around. The white dot and the tubing need to be by that bend, but not over the elbow because that's uncomfortable and hurts your reading. Go ahead and put it on you and tighten it, and then we'll hit the start button. And I'll put this over here. There you go. Nice and tight. All right, hit the button, relaxed.
Systolic 124, diastolic 85, heart rate 93.
As I said, you make the determination about what the voice sounds like to you. Now you want to tap OK, and it records it. You can take the blood pressure cuff off your own. You don't have to hit the button or anything. It will turn itself off automatically.
Would you prefer people sitting down to do that?
I just want people to be consistent. So if you're standing up all the time, then do it that way. Try to stay in the same arm, nurse practitioner, so they will get confused if your blood pressure or your pulse is all of a sudden different. So don't let other people use it. Sometimes kids think tablets are cool. They want to do that. In fact, we're going to have to manually enter for the thermometer because I guess the Bluetooth ones aren't very good. So you want to take that out of the box, get it ready. So you'll push the button, turn it on, put it on your tongue. These ones take a while, so when you get impatient, just wait a little while longer. Of course, I'm the one who pushes the elevator button 5 times, even though I know the elevator's coming.
Does it say low when it's ready?
Yes, it does. So we'll let you take that until it beeps. In the meantime, we'll get your plugs ready, all that kind of stuff. Here. Just plug it in, don't take it out or off the power. If it hibernates, you just tap the screen or tap the side button and it'll wake back up. You just want to leave it somewhere where it's accessible, so when your nurse practitioner calls, you can do that. I told you it takes a while. Okay, what does it say?
98.7.
Okay, 98.7. So we're going to hit the, yep, you're a stellar student. Yeah, we're going to deactivate that, put it back in its case later. Uses the pluses and the minuses like you figured out to enter your temperature. Of course, this is in Fahrenheit. Hit record. Now you're done. You need to do that twice a day, every day. This is what allows you to stay home from the hospital. If your vital signs go out of the pre-established parameters, you will get a phone call asking if you're all right. Other things, if you want to call up your vital signs again, hit the tracking on the side. We don't use all these functions right now, but for instance, hit the temperature. It'll tell you the date, and a white dot will appear on the bottom here. There you go, last one. There you go. 98.7 is your temperature entered. Every day it'll go down, a dot will appear, and you can see trends. You can do the same thing for your blood pressure and your oxygen level. Just like that. MAP is mean arterial pressure, but systolic and diastolic. And that's it.